This fellowship has been ongoing for many decades. It began under Rick Rauch. I was hired in order to help bring that fellowship to be entirely within the academic family here. Now we have 5 different clinics across the region, multiple areas of procedural space associated with each of those. And we've opened up several ASCs across our community that we practice in. One of the interesting things about this fellowship is you will also get a little bit of a flavor of what the real world looks like. One is in the clinics. Another is for procedural medicine in the ambulatory surgical centers, or ASCs. And the third is in a hospital-based or provider-based clinic, which is called HOPD. We are a highly interventional program. The majority of what we care for is really painful spine conditions. People often put themselves in either I'm a pain physician or I'm a spine physician bucket. The reality is that's probably a difference without meaning. At this program, you're both a pain and a spine physician.
At the beginning of the year, we go through several steps, including things like cadaver labs. We do boot camp. We do rounding inpatient with some of our NPs there to really allow the incoming fellows to get comfortable in a variety of environments.
Most fellows who are going through this program become adept and ready to go out independently on their own really halfway through the year. You have plenty of opportunity to do all sorts of advanced procedures and a lot of bread and butter opportunities as well. So most fellows who graduate from this program are doing somewhere between 1,000 to 1,500 basic procedures, and a large number of those are advanced procedures.
Our fellows train in both university and community setting, where our fellows are able to obtain a full spectrum of interventional pain medicine. Our multidisciplinary fellowship programs allows our trainees to work side by side with leaders in neurology, radiology, neurosurgery, and physical medicine and rehabilitation. Our fellows play a pivotal role in the teaching and training of their junior colleagues, whether it be anesthesia interns, residents, or medical students.
Our program is primarily built on one-on-one relationships. You'll work directly with each of our faculty members. Every fellow has direct access to our faculty who are all invested in your growth, not just as clinicians, but as leaders, teachers, and people.
The very first 2 weeks of fellowship, there's a boot camp. And during that boot camp, we try and get you up to speed. I personally teach you needle driving, which is vastly important for the remainder of your career. But we also have cadaver labs to teach kyphoplasty, spinal cord stimulation, dorsal root ganglion stimulation.
You really don't know the topic until you actually try and teach it to somebody else. You're watching us do something once, then you're doing it next, and then the typical medical thing, you're teaching it on the third part.
Clinical research is absolutely something that any fellow can be a part of if you have that interest.
It is not required that you write a paper, do a research study, or anything along those lines. However, if you are interested, there are plenty of opportunities to do so. Many of our previous fellows have published papers doing research with and attending, whether it be a clinical trial or something else. We really focus on this because our program is one of the top 5 programs when it comes to research funding. So there's lots of different opportunities, and that is something that makes this not profoundly unique in pain fellowships, but it certainly does make it different than, we'll say, 90% of the fellowships that are out there.
During this 1 year, it's just an excellent opportunity to have a well-balanced education, both procedurally, and also have an introduction to industry. So they have really good mentorship, not only with the attendings, but they also have great networking opportunities that are very helpful as they forge on into their career.
Seeing a lot of different clinics gives you the opportunity to see multiple different subsets of patients. So you see a lot of folks from different socioeconomic backgrounds, racial and cultural backgrounds. You see those folks from that more rural type setting, and then certainly the folks in the Winston-Salem, Greensboro, and High Point areas as well.
Standard procedures that we do, getting absolutely proficient at those procedures will tee you up for success to learn any new procedure that may come along. particularly advanced procedures, for example, SI joint fusions.
60% of our clinical time will be done doing procedures, whether in the operating room or one of our many procedural suites, and about 40% doing clinical duties.
The beauty of our fellowship is that you have a multitude of attendings. We all do the same thing, but a little bit differently. And so by the end of the fellowship, you can pick and choose what you feel is the best way that suits your style of doing a procedure.
In pain medicine, mentorship isn't just part of the program, it's the heart of our program. We believe that the best learning happens when you feel supported, encouraged, and valued.
Not only have they been there the entire time to watch me grow and teach me from a clinical perspective, but they've also been there to help with personal issues that come up in life. This is truly a well-rounded pain medicine fellowship that allows you to grow at the right pace.
So as a pain fellow, you make the most of your weekends. You're on call only about 1 out of every 6 weekends, so the other weekends are kind of yours to do whatever you'd like to do. If you want to travel to the mountains, get the scenic views there. There's opportunities to travel out to Boone or to Asheville. If you want to go to the beach, that's just a few hours away, something that you can do easily in the weekend. There are 3 airports in the area here that are easy to travel to, and you can get most places direct with that. There are multiple children's museums. There's one in Winston-Salem, there's one in High Point, there's one in Greensboro. Greensboro is home to the Greensboro Science Center, which has a pretty moderately sized zoo attached to it. Greensboro is home to the Greensboro Coliseum, hosts the NCAA tournament. Whether you're into sports, whether you're into family life, whether you're into traveling, whatever it may be, I think there's a lot to be said about living in this area.
We have a culture of collaboration here. We celebrate successes together and we navigate challenges as a team. Our fellows leave here not only with advanced skills, but with lifelong mentors and friends.
Working with the physicians, working with the nurses, working with the front desk staff, each interaction rejuvenates you each day. Why? Because these people are not just coworkers, they become your family.
We're committed to walking alongside of you step by step as you grow into a compassionate, skilled pain physician. If you're looking specifically for a fellowship where mentorship feels like family, where support fuels your growth, and where you'll be welcome from day one, you'll certainly find it in our program here.
If you're ready to join a high-impact, high-volume program, then Wake Forest is where you need to be. We pride ourselves on compassionate care, excellent education, and research.
We want to make sure that our patients are getting the best treatment from very caring and compassionate physicians.
As Maya Angelou said, people won't always remember what you say, but they'll always remember how you made them feel. And these are the kind of physicians that we are looking to train at our program.